This Wellness Wednesday, we are highlighting that March is Colon Cancer Awareness Month, and screening that can really be the difference between life and death. Colonoscopies, they don't just detect cancer, they can actually prevent it by removing precancerous polyps early. We're going to get into all the science of it and also the research with Dr. Rucha Shah. She's a gastroenterologist here with Honor Health, talking to us a little bit more about screening and also why this seems to be on the rise here for so many across the country. It is the second leading cause of cancer deaths. Is that correct?
It's actually now the leading cause of cancer death in men under 50 and women very close behind breast cancer.
Gosh, this is heartbreaking. I mean, I know we were just talking recently that Catherine O'Hara, James Van Der Beek, Chadwick Boseman, just a few people who kind of really brought it to the forefront that this is happening to people young. Not that you would think.
No, and that's one of the reasons that we've actually moved our screening age from 50 up to 45. So if you have no family history, no risk factors, at 45, you should be in the door getting screened for colon cancer.
And is this a screening that happens once a year, twice a year?
So I think the most important thing is the screening that you do is the best one. Okay. I'm a gastroenterologist, so I recommend the colonoscopy. So colonoscopy is a test where we put a camera the size of my index finger into the colon and look for polyps, remove these polyps, and prevent them from turning into cancer. So if you have a clean colon with no polyps, you get 10 years for your next screening, which is an incredible amount of time.
Yes.
But if you do have polyps, we can get in sooner, 3 years, 5 years, 7 years, depending on the type of polyp, where it is, how we removed it, to keep on track.
Yeah, because this is something you said, if you detect it early, I mean, you have a very good chance of beating it.
Yeah, I mean, it's incredible to say that if we find it early, there's a 90% survival rate, even if we find an early form of cancer. So it's not all lost.
I want to talk about what are those signs that, you know, maybe that we're missing, that something is wrong and that we should go get checked.
Yeah, so the problem with colon cancer screening is you don't want to wait until you have signs. But if you have signs, you definitely want to get checked out. So forms of rectal bleeding, it's just not normal to bleed. There's always a reason. If you're losing weight without trying, we wonder if you're getting adequate nutrition or something's going on. If you're having signs of a blockage, feeling there's been a change to your bowels and you can't really explain it with your diet. And then if you have a family history of colon cancer or colon polyps, I wouldn't ignore any symptoms.
Yeah, not at all. All right, we have about a minute left here. I want to talk about some of those changes that we can be making to our everyday life that maybe can help us have better colon health. And one of those is things that we eat.
Yeah, 2026, it's a year of fiber. Yeah. It's really important.
Year of fiber.
It's really important to understand what we're putting in our body. Fiber not only helps you have good bowel movements, but it also helps promote healthy gut bacteria and helps with anti-inflammatory changes in the gut. So aiming to have at least 30 grams of fiber every day, fruits, vegetables, supplemental fiber, adding a little bit of flax, using raspberries in your morning oatmeal, cooking some broccoli on the side of your eggs, all of those things can help promote a healthy gut and prevent cancer.
Well, at least something that we can do right along with getting screened, getting those colonoscopies. Dr. Rucha Shah, a gastroenterologist with Honor Health, thank you so much for being here.
Thank you so much, Allison.
Such an important conversation. Again, March is Colon Cancer Awareness
Sign
Month.
up.
Yeah, sign up and make sure that we can spread this to everyone because we want those rates to definitely come down.